I would consider myself a trauma-informed worker, so I'll do my best to answer these things. I am certainly no trauma-informed guru, and I also, out of full transparency, I get frustrated when the word is thrown around for no reason. And I was just doing a lecture about this earlier. We have a really good friend of one of our lecturers at our university doing a talk, she's doing a trauma-informed study about with homeless people. And she's actually done this amazing thing where part of the funding she received, she has like breakfasts at cafes, and she's recording all of this sitting at a cafe with like 15 homeless people and just having breakfast together and coffee. And it's really cool. It's so interesting. And she said, it's really important that we take a trauma-informed lens. And so I piped in and I said, says who? There's no way that data came from sitting with homeless people in a cafe. And she said, well, I think there's implications of this. And I said, that's a better answer, because clients do not show up trauma-informed, right? They have no idea what this word means unless you're working with another practitioner. The other problem is I meet a lot of agencies that say, especially when I consult with adventure therapy programs, we do trauma-informed practice. And I say, what difference has that made to your programming when you implemented trauma-informed? Well, they respond, trauma-informed let us know that what we were already doing was already trauma-informed. And then I meet people like Graham Pringle, whose work looks drastically different than anything else that I see. And maybe there are a lot of implications for trauma-informed and taking therapy outdoors. I totally get that. There's also a lot of things that we do. What about comfort zone? Get out of your comfort zone. I hear this all the time. Are we really going to tell someone with complex trauma what the problem is you're too comfortable? Meanwhile, they can't sleep, their diet sucks, they want any substance at all to make themselves feel comfortable. They'd even harm themselves to feel comfortable, or go after sex, or buy too much crap and can't sit still. So this idea of out of your comfort zone, so this is where we have to actually take these notions really seriously. And this is where, I think a theme of this talk is really reflecting, what do the words we use to define our work really mean? And sort of a good journaling experience would be, if you are on mute, right? If I videoed one of your sessions and I watched it on mute, what would I see you doing that would indicate you're trauma-informed? What would I see of your body posture? And what would I see that would, this is one of the other things with trauma-informed that's pretty funny. Have you ever met someone who would say they're trauma not informed? So it's like, there's no trauma uninformed practice. Like, I don't buy into that trauma informed stuff. So it's fine. It happens to all popular things that come in. It's not just the trauma informed, but really consider, if I watched you on mute, what would I see? If I listened to the words you said, what would I see? If I looked at how you planned your day for a session, what would I notice that would indicate you're taking these implications from trauma-informed and bringing it into your work? The next step of being trauma-informed is how you identify triggers or healing. If we're standing up and abseiling, rappelling down a rock, or rock climbing, and we see that our client is a bit anxious, what can be tempting is to say, just go a little bit. Now we're pushing their trigger forward. Just go a little bit. Now, could that help with some distress tolerance, things like that? Absolutely. But even at the bottom, they're already distressed. They're already showing you signs, so we don't push them. And we don't want to end up congratulating them. I can't believe you made it to the bottom of the rock or the top of the rock, even though you were with anxiety. Because then we've perpetuated the role of the person who doesn't have their best interest at heart. We wouldn't ask them to do that if it was virtually any other circumstance in life. And so the next half of that question is, how do you assess pre-outdoor sessions or post-outdoor session? So first off, I do ask the client for a ton of feedback. Um, the other thing pre-session is I want to let them know everything they can expect to happen. Because remember, if we're dealing with someone, and I'm using the context of children, substitute domestic violence, substitute workplace people, the way that you all know, whatever your professional context is best. If I know a young person experiences complex trauma because they had um, unpredictable caregivers, so we're not necessarily saying there is this reckless abuse and reckless neglect. Obviously, we all know that. But we also know a mother or father who have, or whoever, have different partners coming in and out of the house, are substance using, so that when you're crying, they're passed out drunk and they're not there to wake up one day. All of this unpredictability is what leads someone to become quite rigid in their thinking because they've had to protect themselves their whole life. What we need to do, so if our adventure therapy program is unpredictable, we're going to be perpetuating the same thing as before. So I've worked on a lot of programs in the States where we say we don't provide future information to clients. We don't tell them what time it is, don't tell them what time lunch is. For years, I loved it. What it does is it gets somebody to try to be in the moment. Don't worry about lunch, it'll come, but just stay in the moment. But what if they're asking this question because they're feeling the anxiety pop up of not knowing what's going on? And they need that sense of control. So if trauma comes from unpredictability, moments of terror, our outdoor program should have the exact opposite of that. And so we want to work young people up to feel for the bigger, more risk-taking adventures. Or if you have a client who comes in and says, I just want to go climbing and have a badass time, you might feel comfortable to do that. But it is about considering, and this goes, the cool thing about Trauma-Informed is this goes deeper into decolonization or patriarchal perspectives, is if we're just the boss and we get to choose what happens when it happens and everyone else is just to fall in line, we can perpetuate a lot of the things in society that impacts people at a bigger picture level. And so this fly is tormenting me. And so Australian summer, flies, crazy. So yeah, so we want to really, we want, oh, I'm going really deep here, and this is probably irrelevant, so feel free to cut this out. But some of the people who were really big in founding experiential education, and what's really interesting, you have William James, who is the founder of, and this is an American perspective, so that's limiting in itself. You have William James, who is the founder and one of the co-founders and first president of the American Psychological Association. We have Jane Addams in Chicago, who's considered really the guru of starting social work. She was incredible. You have John Dewey, amazing experiential education, wanted to flip education on its head. And you also have Kurt Hahn, founder of Outward Bound. Founder is the wrong word, obviously, because his partner and his wife had a ton to do with it, and she often gets neglected. So I picked 4 people. All of them really thought the best way to cure society's ills was that when young people go to school, or young people go on programs or adventures, and adventures, obviously, we're thinking about Kurt Hahn, that the group, the container of the group, or the container of the classroom mimicked the world's greatest democracy of how people work together to solve problems. And Jane Addams famously said, the greatest cure for a poor democracy is more democracy. And it starts with our youth. So if people on our programs feel that they can contribute, they can take the lead when it matters, that their voice will be heard, you're giving them the experience of the almost the highest ideal, right? Now, obviously, we don't have a lot of perfect democracies in the world, so how you define that, I have no idea. But I really like this notion, and I think there's a lot of trauma-informed implications to this, that our client shows up knowing that they count. They're just as important as the leader, or at least they can be if they want to. The goal is as far as they want to go in life, because there's ideally no barriers that they will resist to getting there. And so how do we frame trauma-informed psychotherapy in the adventure practice? I think I answered a bit of this, but the thing with trauma-informed is it's about our focus. It's about how we see what's going on. So I know I've read a lot of Bruce Perry's work, and we talk about, the first thing we have to do is regulate, help that person feel regulated, and then we can build relationship, and only then can we reason. And the word reason is talking about the problems, the talk therapy. So trauma-informed adventure therapy would look like not a lot of talking at first. It would be making sure they feel comfortable setting up a tent, that when they're walking, they're not getting blisters and they're not getting hurt. They're not scared at night. And if you're on a long expedition, being homesick's brutal. So how do you regulate someone? You regulate them through proximity. No matter their age, if they're scared at night, have a book with you on program and go read them a book at night, so they have someone next to you. Make sure if you're camping and everyone's in different tents, that you really take 10 minutes with each group to say goodnight. Let them know I took a lot of that away from my time in Alaska, where I've gotten to know Kyle as well. It's about regulating. It's honestly no different than soothing a child. And everybody soothes a child by holding it. And so even touch, consider your relationship with touch. There's so many senses on the fingers. I bring, fancy Bose headphones, noise canceling. If I have, I guess this is a pretty interesting story. I had a young boy come on a trip, Aboriginal Australian. He was born with, had an intellectual disability. His brothers had stolen a car. So they stole the car. They got to his house. The brothers got out of the car, but the other kind of friends in the car, my client got in the car, and the other friends were all drunk, and they drove the car into a train, killing everybody in the car but this boy. So not only does he have limited intellectual capacity, he's got a life of being an Aboriginal Australian in Australia, which can come with a lot of trauma, being raised by people from a stolen generation. There's all these contexts going on. We decided one day as a group, day 3 of an expedition, we're going to go hike, and we're going to break the record of our program for the longest hike. And I thought this was fine. We were hiking like machines. It was amazing. It wasn't necessarily a hard hike, but there's one section where the distance was pretty boring. Like it was just a straight flat line for probably 8 kilometers. And everybody had their head down and they're just walking. And I probably turned off my therapy thoughts, because I was like, everyone's quiet, things are fine, we're just cruising. And we take this turn into a creek bed, which is one of the most beautiful walks on the property we go to. Now I'm excited. Stop in the shade for a break. And he just says, I have to die. And we went, oh, we're as far as we can be from help in the most hardest way to get someone to help you. And he's sitting down crying, talking about how he should have been the one dead in the car, that he didn't know what to do. At that stage, am I going to reason with him out of it? And I think the word reason can feel judgy, but it's not, he's not smart enough to talk about this out loud. I'd never think that way about any of my clients. It's more, Is talking about this going to be what's most important? And so what did he need? He needed two staff side by side with him, hearing him out. And then an arm around him, letting him cry, rubbing his back, right? A lot of people, we all do this. We get in a shower, and what's the first thing we do? Turn around and let that thing hit the middle of our back. Very good for endorphins, very good for our neurotransmitters, rubbing his back. I said, do you want to listen to this thing after we're starting to realize he's regulating? Do you want to listen to a mindfulness? It's only like 5 minutes. Puts on these noise canceling headphones. Now he can't hear the other group. He's going into his own thing. He lies down. While he's lying down, obviously comfortably, you know, maybe you'll get your backpack and prop it up for him. We want to show that we're there for his care. Myself and the other worker who was working on me, rubbing his hands, right? Rubbing his fingers, letting him know that there's people here caring for him, that he's not alone, and also getting his body to start soothing itself, to start soothing down. I don't care if he listens to the thing or not, but what's really funny is the meditation he was listening to. First off, he fell asleep totally. So that's how worked up, so exhausted in 10 minutes, he's passed out. We see this with anger. Clients get so angry, and what do we respond with? I need to control risk. So we're stopping to listen to the kid. And obviously we have to protect him, protect the client, protect other people in the group. But the trauma-informed approach is not just stepping in and tackling and then going, let's figure it out. If you do have to restrain somebody, we have to, as quick as possible, jump to what we did with that kid. That we did it as a caregiver, not to prevent risk. Because if it's only about risk, we're not giving the client the right to freely experience their experience. What we decided was, let's embed this meditation stuff into the program for this kid. That when we take breaks throughout the day, he can do the next meditation. And the phone app we had, it was great. It had levels. So he thought he's getting better. He's getting to the longer one. Isn't this amazing? And sure, we had ups and downs, but he had no problem laying there and sitting there and thinking about and doing the meditation. So we've given him a strategy to calm the brain. We've been there soothing as soothing practitioners. And what was really funny, sorry, at the end of each of those meditations, the person talking is like, really appreciate that you did this today. Thank you so much. I'll see you tomorrow. And the client would go, thank you. And with big noise canceling headphones on, we didn't know it. Say, thank you so much. That was really awesome. Really appreciate it. Like talking to the guy on the app, it was really adorable. A few months later, that client called me, let's go hang out. And I said, oh, sure, no worries. Like, because we get follow-up funding. So we started getting together, and like any expedition, there's been ups and downs after life in the expedition. And he said, I'm ready to come back. And I said, really? You did struggle a bit at times. Like, how do I know you're going to be right for this program? And he said, because I'm gangsta now. He's like, I'm hardcore now. So it's sometimes the trauma-informed brain has less to do with talking and more to do with really soothing people. So I'd really recommend reading, if you haven't already, Bruce Perry's The Boy Who Was Raised as a Dog, because what Bruce Perry really stands for is, a lot of times, and we can see this in troubled kids, if we work at a school or we work at a residential program, the kids who aren't engaged, they like the PE teacher, they like the janitor, they like the lawnskeeper, they like the people who have nothing at stake, because it's just building a more honest, democratic relationship. It's why every school should have like an adventure therapy engagement professional, where their door is open to come sit, to be in proximity with a caring adult, and those sort of things. So I think that sort of answers most of the trauma-informed things. The last question I put here from Arva, I believe, I hope I've said that right, is working with personality disorders. I personally have very little experience or knowledge in this, so I'm not the person to answer this. I would go to Google Scholar or something like that and look at different treatments for personality disorders. I know sometimes with borderline personality disorder, we look at someone named Aaliyah Littleton has worked with borderline a lot, and she does a lot of dialectical behavioral therapy in the outdoors. So it's happened before. I'm just not the person to answer that question. Um, but besides that, I thought these were all really amazing questions. And one of the best things is just saying these things out loud. It just like as the theme of this talk, it helps me to articulate what I do better. So trying to take, even if we're using words like solution focused, feedback informed, trauma informed, a lot of people say words like holistic or integrative. See if you can really say, what does it mean to be trauma informed in my work? What does it look like? And really write it down. And then the great news about writing it down is after a session, look at what you wrote down. Did I do that? Is that actually what my work looked like? Even better, if you have permission for a client to record your work, record it. It's the best way for you to get better. It will start with you hating yourself, right? I won't watch this interview back because I'll go, Will, you sound like a moron. But you'll hate, if you want to hate yourself, watch yourself work. But that's one of the best things to do.